Difluoroethane is an organofluorine which is used as a refrigerant, foam expansion agent, and propellant for aerosol sprays. This class of chemical received widespread adoption in gas dusters and consumer aerosol sprays as an alternative to CFCs. So when inhaled, it causes acute onset of euphoric effects. This, of course, is not without consequences, and some of the adverse effects include nausea, vomiting, skeletal fluorosis, hypocalcemia, and cardiac arrhythmias. So in this case, we present a 51-year-old male who presented to an outside facility with severe hypocalcemia and severe rib fractures following a fall, which he sustained while intoxicated with the inhalant. He additionally had a recent history of other fractures. While he was inpatient with us, he did admit that he had been using a keyboard cleaner as an inhalant for pain control for the previous month. So when our patient initially presented at outside facility, he received an x-ray which showed numerous fractures from his fall, as well as numerous healed fractures, both on that side and the opposite. He had a calcium of 4 milligrams per deciliter, corrected at 3.9, which interestingly enough he did not show symptoms from. He additionally had a low vitamin D and parathyroid hormone of 475. Over the course of the 9 days, he required over 40 grams of calcium, 36 of which was calcium gluconate given IV, to bring his calcium up to 8 milligrams per deciliter. He remained asymptomatic aside from some oral mucosal injury he had suffered from the inhalation before. He was discharged from our facility with plans to follow up with endocrinology. So in our patient, the acute refractory hypocalcemia was kind of atypical for acute difluoroethane inhalation. In most circumstances, after the acute incident is passed, the hypocalcemia can be corrected, or the patient has succumbed to an arrhythmia. Exacerbating factors would be these chronic steroid injections, vitamin D deficiency, or the hyperparathyroidism, or he had been using the inhalant much longer than expected. The difluoroethane causes a hypocalcemia via a number of metabolic changes, which can actually also impact the citric acid cycle and cause an issue with energy production in the body. And as of now, there's no antidote, but there is some hope that with cytochrome P450, there's an ability to potentially have an antidote or otherwise treatment in the future. In this case, we really wanted to bring awareness to inhalant chemicals that can cause severe hypocalcemia and other rather severe medical problems that you wouldn't normally think of or be tested on in your normal medical education. Thank you.